My name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It's October 7th, 2025. Yesterday, Deputy Secretary Jim O'Neill, who's also the acting director at the CDC, posted something. Here's what he posted. Thank you, President of the United States, for your leadership. I call on vaccine manufacturers to develop safe monovalent vaccines to replace the combined MMR and, quote, break up the MMR shot into 3 totally separate shots. So where does that come from? Let's go back to the beginning. In 1998, Andrew Wakefield, a British physician, published a paper in The Lancet claiming that the measles, mumps, rubella vaccine caused autism. He believed that the reason that it caused autism was that by combining that vaccine into one shot instead of 3 separate shots, that you then increase the risk of autism because somehow you had blunted the immune response, allowing measles virus to reproduce itself at the intestinal mucosal surface, which then damaged the intestine and then caused the entry of brain-damaging proteins, which then traveled to the brain and caused autism. Now, he had no evidence for any of this. He just made the claim. But it raised the hypothesis, could MMR vaccine cause autism? Since he published that study in 1998, there have been 24 separate studies done in 7 countries on 3 continents, looking retrospectively at children who got the MMR vaccine and compared them to children who didn't get the MMR vaccine to answer the question, were you really at greater risk of developing autism if you got that vaccine or if you didn't? And the answer was consistent in all 24 studies, no. So Andrew Wakefield's observation on 8 children who'd received the MMR vaccine and then within a month of getting that vaccine developed autism was wrong. So now we know that the MMR vaccine doesn't cause autism. Therefore, there is no reason to separate the MMR vaccine into its 3 component parts because it won't lessen the incidence of autism, given that it doesn't cause autism. So what now? What Jim O'Neill is suggesting is that instead of having 2 vaccines given at 12 to 15 months of age, and then again at 4 to 6 years of age, that we have, instead of those 2 shots, that you get 6 shots, 3 shots at 12 to 15 months of age, and another 3 shots at 4 to 6 years of age. So you go from 2 shots to 6 shots with no advantage. It will make it more expensive, it will make it less available, and it won't do anything to change the perception of that vaccine other than to make it more difficult to get, and therefore lessen vaccine rates and no doubt increase the incidence of those diseases, especially measles. So there are 2 companies that make measles, mumps, rubella vaccine in the United States, Merck and GlaxoSmithKline. Merck has recently put out a statement saying that they have no intention of dividing that vaccine into its 3 component parts because there's no medical or scientific reason to do that. I haven't seen a statement yet from the GlaxoSmithKline, but I can only hope that GlaxoSmithKline will follow Merck's lead. Because if either of those 2 companies went along with that recommendation, that would be an example of corporate irresponsibility because it would not serve the public's health. Thank you.